Hello, everyone. I just wanted to give you some insight and follow up. For those who follow me on Facebook, there's been a few posts I put out there of feeling quite defeated. And for those who are following through the blog, just to give you some insight on a situation that occurred. So, of course, going back to March 31st, started to go into an exasperation, flare up, all the lovely phrases for when your disease starts acting up. I had paralysis from the stomach down to the toes. Now, not paralysis that necessarily kept me from moving, because with assistance and a cane, I was able to still move, but it was difficult sensation in some part of the legs. Was really bad. And it was similar to when I was first diagnosed, which I actually lost the ability to feel my lower extremities for 4 months. I didn't know if I was coming out of that, and I just graduated college single. It was quite devastating to be in that position, and then now fast forward almost 7 years later, similar experience, but now married and a stay-at-home mom. Doesn't change the emotional effects it has on you. So, like most people that have MS, Solu-Medrol is the drug of choice to help with inflammation. I've been given this for the past 7 years. Have never felt relief from it. Didn't know if what I was experiencing is common. All I get was muscle pain. So I have issues in the lower legs. I start to get pain in my wrist, in my joints. The insomnia, of course, which I think is a normal side effect, but I get nauseous. I get really bad headaches, and it was very uncomfortable. And so, being that this is the world of the disease, and this is what they give you, this is what I followed through with. And I would have to say, I don't think I think I can't take that anymore at all, because I don't think it helps me whatsoever. So then I was introduced to a drug called Acthar about 6 days ago. I guess they used it for MS patients back in the 80s. It's pretty awesome, all the stories you read. This used to be the go-to drug, is Acthar. People used to call it the silver bullet. I don't know why the MS community is not more involved in this drug. And I'm not advocating people don't do Solu-Medrol. This is my personal experience. So please, if you have MS, always do what's right for you. Make sure you ask questions, educate yourself in different options, as I'm always trying to do for myself, and I'm still confused half the time. So I'm sure you've seen articles. Acthar is about $28,000 on average for one small little vial that is for 5 doses. So the insurance, we kept calling and had issues and never really got through with them. So by background situation, I was able to get a sample vial for the 5-day supply. Now, when I was first told about this drug and was given it, and communication, I think, was not understood. It seemed like I needed to be on some kind of treatment for a few weeks. Actually, I understood 3 weeks. My husband thought 3 months. When we first went in to see the neuro, we were just scared, confused. I lost feeling in areas, and you don't know what to do sometimes. That this disease is unpredictable, and it's scary, and you don't know what is permanent, what's not. You're fearful. It's not a good thing. So, needless to say, when I first got the sample of Acthar, by the second day of using it, I already started feeling improvement. I have never, ever had a drug that helps with inflammation for this disease ever helped me this way. So to me, it was amazing. I did not get full sensation back, but I started, like, some areas that really cold, numb, and fuzzy, I started to get feeling again. So to me, my hope is being restored. I'm having faith again. I'm feeling, oh my gosh, there's something that's going to help me with this exasperation. Of course, we all want to be hopeful that we're going to have a complete recovery. And, mentally and emotionally, you kind of have to put your brain in that place, because if you don't, then it's easy to just say, well, nothing works. This is it, and that's not my attitude most of the time. So in this case, I'm feeling better. So by the time I'm on the 5th injection for the Acthar, it's a neuro appointment, and in the whole time still trying to get the insurance, calls every single day to try to get them to send me the medication, because again, I feel communication and understanding on all parts of parties was not expressed correctly. So me as a patient, I'm holding on to this hope. I'm feeling a little bit better. I'm feeling motivated. Obviously, when our spirits are higher and we're motivated and we're feeling some help, and assistance of our bodies, we're going to be more happier. We're going to be more focused. So I'm feeling, okay, and we're going to figure out getting another vial so that I can continue the therapy, the Acthar, and, hopefully progressing and feeling better. So I go in to the neuro and I express, and he says, well, what's your, right away, just like, well, what's your percentage of how you feel like improvement? And I would have to say 50% comparison to where I started from just using this drug for 5 days. And needless to say, it went downhill from there. He's like, okay, well, 5 days is all you need. And, I was trying to show improvements. I didn't bring my cane because I thought I needed to show off that, hey, I'm doing a little better. So this treatment's working, like give him faith and stuff. But I still do need my cane on occasion, I'm stubborn. So sometimes I don't like to use it. And sometimes I feel like it actually inhibits me because it's not my balance that's off. It's just the numbness. And then so sometimes I need it because lifting a leg on a curb or something, like I don't know then if it's going to hit it. So at times, but basically just like 5 days is all you need. He's like, that's what's typical, 5 days. And then for people who are still having issues, or for who are in paralysis or whatever, they'll do 10 days. And then I felt my heart drop, because it's like I felt like, okay, something's helping me and we're saying this is it now. And then but I never understood any of this to begin with. This whole Acthar was new to me. And then I just felt like it was kind of like, yeah, explicit, you get on with your life. Like that's what it felt like. And an argument did ensue because I just felt my heart just being crushed. It's like you found something that's helping me, and then now I understand this is it. So then the fear comes back in, because does it mean, okay, that now that this is over, these leftover feelings, this not full recovery, is this now my new me? Is this my new bottom line? Is this where this disease has taken me? I don't understand that. And then, and I'm asking these questions and I'm scared, and I'm getting negative energy back from the medical staff because I ask questions, and because I care about my health, and I'm scared, and my husband's trying to keep things cool. And of course, Gavin has to start acting up, and then he gets annoyed by Gavin's every little like, oh, like it was horrible. And so I felt defeated. I felt like I didn't understand. I had something that was helping me, and then now I'm supposed to just say, okay. And then so I start asking about, well, what's my bottom line? And then the first thing is, well, I can't answer that. I know nobody can answer that. And then like later on in the discussion, it's kind of like, well, in 3 weeks, we should have an idea. The medication will still stay in your body, so on. And, I can be fine that 5 days was supposed to be it, but maybe like educate me on that, because I did read about the drug. There's so much, information out there. Some people did in fact get 5. Some people get 10 that had the paralysis like the way I did to initially start with. Some people get 3 weeks. Like it depends on the doctor. So, how am I supposed to feel? Obviously the insurance doesn't want to do it. So maybe the idea was 10 days for me, but we're going to stop because we don't want to fight with insurance anymore, because they're just not going to budge to do that. Because that's another side story, that the insurance has denied it over 3 times for saying it's not a medical necessity, when Solumedrol was the other option that made me violently ill. Thank you, Leela. That was a good expressive word to use, because it really did, and that should not be how you feel with that. So